Actually, some stress is termed good stress or eustress. Eustress is beneficial to the person experiencing it. It motivates people to develop the skills they need to solve problems and meet personal goals. However, it's distress that causes problems. Distress is a negative experience that can drain our energy. Increased stress and anxiety can trigger depression, cause confusion, and instill helplessness or hopelessness, causing fatigue. When individuals feel stressed out, they may have trouble sleeping or eating, experience headaches or back pain, lose interest in favorite activities, feel tense, and become irritable, and often they feel powerless in their daily lives. Long-term chronic stress can cause us physiological harm and emotional difficulties. A stressor, the thing that triggers stress, can be real or perceived. Stress can be psychological, as seen with anxiety or guilt or even joy. It can be physical, such as stressful environments, including loud noises, extreme heat or cold, or other disturbing physical conditions. Stress can be psychosocial as well. This is a threat to self-esteem, acceptance in a group, social status, or respect from peers or coworkers. Stress can also be spiritual, such as an existential crisis. What should I do with my life? Or where am I going in my life? Or is there a God, and what does he want from me? We all have individual thresholds for stress, but stress is a part of everyday life for everyone. The stress response is also referred to as the fight or flight response. The fight or flight response is survival mechanisms by which our body and our mind become immediately ready to meet a threat or stress. In times of stress with the sympathetic nervous system, it assumes control and sends signals to the adrenal glands, releasing epinephrine and adrenaline. The circulating adrenaline increases the heart rate, elevates blood pressure, increases blood flow to the skeletal muscles, and increases muscle tension. Respirations will also increase, bringing more oxygen to the lungs, which is then sent to the brain, increasing alertness. Cortisol is the primary stress hormone. Cortisol helps to supply cells with amino acids and fatty acids for energy, as well as diverting glucose from the muscles for use by the brain to maintain vigilance. However, when stress is prolonged or people are not able to relax, they remain in chronic low levels of stress. The body stays alert for prolonged periods of time. The chemicals produced by the stress response, including cortisol, adrenaline, and other catecholamines, can have damaging effects on the body, causing physical diseases, including a substantial negative effect on the immune system, leaving individuals vulnerable to autoimmune diseases. According to the Centers for Disease Control, up to 90% of diseases are stress-related. But stress alone does not cause the disease. It only helps to contribute to it.
Fear is so important for our survival, we do something absolutely remarkable. Our bodies begin to react to a threat before we're even consciously aware of what the threat might be. Because when we're faced with danger, milliseconds count. At the first hint of danger, early warning signals are sent to the brain via the optic nerve, to our tiny and primitive fear center, the amygdala. This prepares our body for action. Next, nerve pulses are fired down the spinal cord to the adrenal glands near our kidneys. This triggers a release of adrenaline. Now we're on full alert. Adrenaline is the vital hormone that can flood our body in a split second. As it reaches our lungs, we breathe more deeply and take in more oxygen. It also makes our heart beat faster. Oxygen-rich blood is diverted to our muscles. They are now charged springs, waiting for the signal to run or fight. All this before our conscious mind has even registered a threat. This reaction to fear has evolved over millions of years and is known as the fight or flight response.
Perhaps some of the most common techniques that people use to combat stress include eliciting the relaxation response with techniques such as meditation, prayer, and breathing exercises. Another would be performing physical activity. This helps with deep breathing, relieves muscle tension, and can elevate levels of the body's own endorphins, which induce a sense of well-being. And another would be seeking social support by close family members and friends. Studies have shown that social interactions will provide great buffers for stress and help people cope better with stress. In nursing, we suffer with stress on a continual basis. Being able to control and maintain stress levels will help us to teach patients and family members how to deal with the stress as well. This is a common occurrence with patients in a psychiatric setting, as well as any acute care settings. In the emergency department and critical care areas, patients are put in stressful situations all the time. Understanding this will help to relieve stress and possibly diffuse the stressful environment. Some hospitals and extended care facilities, pet therapy is used to reduce the stress in the patients. The symptoms of post-traumatic stress disorder are terrifying and often disrupt a person's ability to carry out his or her daily activities. Triggers can cause the person to be reminded of the stressful event and disrupt their entire day. Post-traumatic stress disorder, or PTSD, occurs in people who have experienced a highly traumatic event, witnessed the traumatic event, or been repeatedly exposed to the stories about a traumatic event. Events instigating PTSD often involve threats of death or serious injury to self and others. This induces feelings of intense fear, helplessness, or horror. PTSD usually occurs after a traumatic event that is outside the range of usual experience. Commonly seen examples of PTSD include physical abuse, military combat, sexual assault, or rape. The attacks on the Twin Towers in New York in 2001 caused PTSD in many of the survivors. The common element in all of these experiences is the individual's extraordinary helplessness or powerlessness in the face of such stressors. Gilbertson and colleagues quoted statistics that suggested approximately 94% of rape victims met the full PTSD symptom criteria 1 week following their traumatic event. Cognitive behavioral therapy, or CBT, typically is included in the treatment regimen of PTSD patients. Both CBT and SSRIs, or the selective serotonin reuptake inhibitors, have become first-line treatment options for many people suffering from PTSD. Group therapy with others who have experienced similar situations, such as victims of sexual violence or child abuse, war veterans, have proven beneficial for many people. Family therapy is an important therapeutic modality as well. As mentioned previously, early treatment of any comorbid condition needs to be addressed concurrently. A multimodal approach is always encouraged. If you look at the table 10.1 in your book, you can see a review of therapeutic approaches there as well.
Making sense of CBT, a guide to what CBT is and how you can decide whether it's best for you. If you're living with a mental health problem, it can be hard to know which way to turn or what to do to feel better. You might go to your GP, and one of the first things they might offer is CBT, which stands for Cognitive Behavioral Therapy. It combines cognitive therapy, examining the things you think, and behavioral therapy, examining the things you do. The word therapy might make you think of laying on a couch talking to a man with spectacles and a beard about your childhood while he analyzes your dreams. But CBT is actually a very practical type of talking therapy, which focuses on goals and focuses mostly on the present day and things that are affecting you in your life now. The theory behind CBT is that the way we think about situations can affect the way we feel and behave. It does this by dealing with how your thoughts affect your feelings and behaviors, and teaches you coping skills for dealing with different problems. For example, you might make a simple mistake, like, say, burning the dinner. This might make you think bad things, and it might make you feel worthless and inadequate, which could lead you to do things like withdrawing, snapping at your family, or trying to avoid things which you think might go wrong. Or perhaps you've been invited out for drinks with some friends, and you start thinking negative things. This might make you feel anxious and scared, which might make you do something like saying no to the invite, avoiding your friends completely, or using drink and drugs to cope with the situation. Over time, whether it's years, weeks, or months, this cycle of thoughts, feelings, and behaviors may have happened so many times it's become like a habit. You start avoiding situations more and more, or automatically blame yourself if something goes wrong. And the more you do these things, the worse it can get. A CBT therapist will help you break this cycle and figure out what sorts of negative feelings, thoughts, and behaviors might be contributing to the problems you're experiencing. They will help you deal with your negative thinking and help you change your behavior, both of which will lead to an improvement in your mood. CBT can be helpful for people with nearly every diagnosis you can think of, and can be delivered through one-on-one sessions, in groups, self-help books, online, or through a CD-ROM. That doesn't mean that CBT works for everyone, though. Some people struggle with it because they find it just too hard to talk about their feelings. CBT is usually quite a short-term treatment, and so you may find that your problems are too complex to deal with in the time. It can also be quite hard work. Your therapist will probably set you homework, and you have to really practice the skills they teach you to see a difference in how you're feeling. If you don't think CBT is the right treatment for you, you should be able to talk to your GP about what alternatives there are. The Mind website also has lots of information about the different treatments that are available for a wide range of mental health problems. And Mind's info line can also talk to you about what you might find helpful.
Some medications typically used for the treatment of PTSD include Zoloft and Paxil. Anti-anxiety medications are used only for short-term treatment due to the addictive qualities and potential for abuse related to the medications. Prazosin is one medication some clinicians will use for the treatment of insomnia or nightmares, and this one can be used long-term. Acute stress disorder is similar in some ways to PTSD, but will resolve within a month. But it can be a predecessor to PTSD.